Yeah, hello everyone. Hope I'm audible. Can someone please tell me if I'm audible? Okay, thank you. Yes, we'll just wait for 1 or 2 minutes more. Let people join in. Hello, Dr. Prasad. Hope you're fine. Hope everyone is fine and staying at home as much as possible, except for your jobs and regular duties. Yeah. I think we'll just start now. Good evening and welcome everyone to the second session of Prowins webinars. Stay more fit and be more healthy. Let it be the mantra from today. Let us all be more vigilant and understand the importance of injury management in sports career. Yes, today we'll be talking about the same. We have Dr. Ajit Mapari on board with us, who is one of the finest in injury prevention, injury management, and performance enhancement. He completed his master's in sports and exercise medicine from one of the top UK university and has been doing his consultancy for more than 20 years. He has a great work experience within prominent events like Indian Super League, Pro Kabbadi League, First Badminton League, to name a few, and many more. He is a director at ISRA, that is Integrated Sports Science Association, a founder at Fit to Sport. He and his team work in this field for a better future for athletes, guiding them on sport-specific fitness and performance enhancement. So without wasting much time now, let us listen to his valuable inputs about today's topic, importance of assessment in sports. Yeah, and there's one more request. Please ask your questions in the comments section after the session gets over, and as far as possible, let it be relevant to the topic. Over to you, Dr. Ajit, sir.
All right. Hello, everyone. I hope I'm audible. And last on 15th of August, we had some technical glitch, and obviously we couldn't do the session on that day. Um, so thank you, Bharti, for the introduction, and looking forward to have this interaction with all these athletes. Um, Basically, let me just share my screen before we kind of start off. Okay. Um, All right. Can everybody see the screen now? Is it okay? Can you see it? Bharti, can you see the screen? Bharti, can you see the screen?
Yes,
Bharti,
yes.
so let us start now. Okay, is it okay if we kind of go ahead and start?
Yes, sure.
All right. So basically, we are going to try and understand what musculoskeletal screening and fitness assessment is all about. And why it is important is something that you need to know. Basically, uh, as you progress from uh, of your say school or colleges, from one standard to the other, or from one batch to the next batch, you obviously give exams, right? I mean, forget about the COVID thing now, because you're supposed to not give exams or whatever. But otherwise, in normal circumstances, so what you usually do is you progress from one standard to the next standard by attempting examination on different subjects, and then your grade accordingly, and then you obviously pass, fail, or whatever you tend to score. So musculoskeletal screening and fitness assessment is nothing but it is more of having a assessment or other examination of the whole body. Okay, and once you know that you're going to go from this level to that level, you need to understand the baseline parameters, and this is what musculoskeletal fitness and screening is all about. So what I want to kind of understand, make you understand is, um, so what it is basically series of tests that helps determine the physical fitness level and aids in development your personalized program. Now I'll come to this problem point later, but you need to understand that once you understand your weaknesses and your strength, you can definitely work on it a little more, and that is the reason why you need to focus more on getting this particular assessment done. Now why it is necessary is because there are a lot of benefits that go with it. So currently, that you're scoring less in your mathematics, or you're scoring less in your physics or something of that sort, and you have to work more on it to score more marks when you go to the next level, or rather next standard. So to increase your obviously points or other grades in that particular subject, you need to work on hard on those subjects. Now, how will you come to know whether you're weak in that subject is once you start assessing it. Rather, once you start attempting or give an examination, then you will come to know whether you're weak or whether you're strong in that particular. Uh, so, what I basically want to help you all understand is there are benefits of assessment. Okay, so uh, what are the benefits? As I said, current fitness levels you need to know. Secondly is you identify the possible areas of health and injury risk. You develop established fitness plan. Now what happens is once you know you're weaker, you can plan your fitness timetable accordingly. So that is exactly why you should be able to understand that assessments are very, very necessary. Now I'll obviously come tell you what assessment includes and things like that, but primarily you have to understand that there are ample benefits out of this particular assessment protocols, or rather when you do your body assessment, you can evaluate and track your progress. Now as I said, once you go from your first standard to second standard, or from fifth standard to seventh standard, or from second year to third year, you know that there are certain elements that you need to work on so that you score more in the next year. Similarly in body, when you figure out some fitness assessment, you can obviously take it to a different level. Now there is another aspect to it. It aids in motivation. What does that mean is, when you have a complete understanding of your grades at this level, you once you start scoring in that particular subject, or that you obviously, it gives you a motivation that if you work hard, you can definitely score more. Similarly, you'll have to keep on working on your parameters to compare it with what you did last time, and that helps in motivation. Now as I said, what to measure. Now this is very important to understand that assessment is what, so these are the basic parameters that we measure. One is medical evaluation, then is the morphophysiological assessment. I'll come to it one by one. Don't go on this whole subjects, that or the other, the words that you see, these fancy big words that you see. those are medical terminologies, but they're very, very essential that one's to understand. So medical evaluation, morphophysiological assessment, physiotherapy or physical examination, the clinical assessment, then fitness components and skill assessments. Now, what I'm going to do is to help you all understand what each category is, what exactly the assessment that we do in each of these categories. Okay. Now, once, as I said, okay, first is let us see what PARQ is. Now, any fitness assessment or training that you do all over the world, you need to understand that there are certain things that Western world follows, and that is a good practice, that is a fine practice to do. So PARQ is nothing but a physical activity readiness questionnaire that every athlete has to fill in before they start testing or even training for that matter. So what is this PARQ all about? It is nothing but it is a questionnaire that suggests whether you're not carrying any injury or medical problem that is life threatening. Okay, so once you know that these 5 7 questions that you see, this is, you can download this form from the internet. This is a very standardized sample PARQ form that I'm sharing with you. Very important to understand that once the attending physiotherapist or the attending sports medicine doctor or your even your trainer, once they know that you have filled in this particular questionnaire, it becomes easier for them to have an understanding that you're not carrying any health risk when you train or test. Okay, so very, very important. It doesn't have very much about complicated things in this PARQ. You just have to understand that there are no heart elements. You don't get breathless when you climb up on your whenever you go climb stairs and all. You don't get breathless. These are the things that you don't have any medical history of asthma and things like that. So you don't fainting history. These are the small questions that are there, and you just have to answer yes or no. So this is about the PARQ form. So every athlete, or rather wherever they visit any training facility or a testing facility, ideally they have to fill in this particular form. If you are a junior or rather sub junior athlete, you have to have a parent or somebody attending with you when you sign this form. Okay, this is one. Now let us move on to, once you fill up this PARQ, what is the next plan that we do? Medical evaluation. Again, very, very important. So many athletes I've seen in my practice that they don't know their basic parameters. So these are the things that you need to have an evaluation done. Say if you're a professional athlete, you have to do it like once in a year, at least the medical evaluation part, so that you're not deficient, or you're not kind of having any problems in your other systems. Now, what this medical evaluation kind of gives us an idea. It is a comprehensive medical history. So what is this medical history? So whenever you go to any doctor, they obviously will ask you whether you are, uh, having any previous history. Did you kind of have a fall or whatever? That medical history, that is what we usually ask. On basis on that, we obviously have to diagnose the problem. So medical history is not only about injuries and all, as I said, it is also about your other illnesses that you carry, any hereditary problems that you carry, and things like that. So we have to have a comprehensive medical history. One is uh, the immunization history. Now, very, very important again, that all athletes who travel abroad, who for competitions or training, it is very important for you to have a note of your immunization, that is the vaccines that you have taken in when you were a child. So, and obviously most of the parents, they keep the record. So you have to know that you are immunized on all the major illnesses that are vaccinated and things like that, and so it becomes very easy. So very, very important point is immunization history. Every athlete who wishes to travel abroad for competitions, they have to have their immunization history with them. Now, cardiovascular, neurologic, and musculoskeletal evaluation. So, what is this about? Cardiovascular is nothing but just measuring your, parameters of your heart. Heart and lungs is something that obviously means it is important. They're important organs, and you need to know that there are certain elements that go unnoticed if you don't kind of scan them or test them. So you have to understand that these particular cardiovascular system is functioning well, and they don't have any silent kind of problems that these people carry or athletes carry, which can be treated beforehand. Musculoskeletal evaluation, I'll be talking about it a little more. Blood test. Now, again, let me tell you one thing. So many athletes I have seen, they don't even know their hemoglobin levels. Forget about the other blood tests that I'm talking about. Hemoglobin level is something so basic and so important that even if you have not done your tests for a longer time, get the basic blood tests done, which are very, very, very crucial to understand why you are not performing well or why you have developed certain injuries. So it is very important to understand that either you kind of have low vitamin levels, or low hemoglobin and other parameters that we look at. I don't want to go more technical and more detail into what blood test we do, but it is mainly the deficiencies that we find out, any imbalances in electrolytes that we find out, whether your liver and your kidneys are functioning well, your cholesterol levels are fine. And these are the things that are basic and that needs to be understood at least once in a year. For professional athletes, I do recommend to have a proper parameters done. Now, the other tests, which are obviously, as I said, which can be done only when we find some other elements in, say, if we find that the athlete is getting breathless or something of that sort, we can definitely go ahead and do some more tests like treadmill stress and 2D echoes and things like that. But that is again something which is subject to depending on what we find in the medical evaluation. Now, this is another aspect of it. Okay. Now, morphophysiological is nothing but measuring your height and body type and fat percentage, your arm span, your sitting height, your waist hip ratio. Now, these are all parameters which are very, very essential when we decide to understand that there are certain phases in everybody's life which we call growth spurts. So these growth spurts, when we know that the athlete is growing and it is in that particular zone, we can modify the activities, we can add something to enhance that particular growth spurt, so that they not only have less injuries, but they also get a lot of benefit when we do some scientific we follow some scientific processes during that growth spurt. So we can identify when the athlete is in that phase by doing a PHV, we call it. By, as I said, there is arm span, sitting height that we measure, and we come to know how things are moving forward. Especially athletes who are from 10-year-old to say 14-year-old. Very, very important age group when we can identify certain problems. Body fat percentage for senior athletes who are 15 plus, very important to know that they have to understand how their percentage of fat is, not only generalized body fat but also visceral fat. So there are some techniques that we use, there are certain gold standards. Not necessarily every system or every training facility or testing facility will have all the methods, or rather they follow all protocols which are gold standard, but there are different things, different ways of finding out the body fat percentages. Simple and standard thing being a skin fold caliper that we use, where we take thickness of skin from different sides, and then we calculate the body fat percentage. So very, very important to understand that why your what your percentage is, and obviously we can correlate or inculcate it in your fitness program. um, Anthropometry, as I said, nothing but your height and weight and other parameters, the girth and things like that that we do. Let us come to posture. As I said, once if you get down to doing your medical evaluation and your anthropometry, we start looking at the body posture. Very, very important information we get from just by static posture. Just we make you stand, and there are two ways of doing it in the clinic. Currently what we follow here is we take photographs of from different angles, like from different sides of the body, and then we start measuring the angles. Very, very important to understand that once we do these particular posture assessment, we come to know how the body is behaving, whether the shoulders are drooping, whether the pelvis is tilted, or whether there are certain elements that, as I said, we see whether the knees are okay, whether the alignment is proper. And we do this by a specialized software that we use, where it gives us better idea and quantification of all these parameters. So these are high-end technical equipments, not necessarily, as I said, we every facility has it, but uh, especially for posture, there are um, very advanced techniques also available, but these are standard and we can definitely make use of it. The next one obviously is clinical assessment. Now, what we do in clinical assessment is all the joint range movements. Obviously, again, the posture is one part, but we also see the dynamic posture. What I told you was a static posture. We just make you stand in front of the screen, and then from all sides, front, back, and both the sides, we take photographs and measure angles. That is static. But dynamic posture is something that we make you move, and then we decide. There are certain specific measurements, as I said, we do using basic equipments like goniometer, which you see in the picture, where we just measure the knee angle and things like that. So we can measure all different angles of your joint to understand that whether there are any differences from one side to the other side, like, right and left side. So we have to compare both sides and understand whether there are no indifferences, and if they are, then why is it so, and if it is, then how to correct it. That is basically the whole reason why we want to do this clinical assessment. So this is just a sample sheet I want to share with you to understand that what how we kind of measure and just put it in the data, and then understand whether these particular parameters that we measure when we examine from head to toe, whether they are in the expected ranges or whether there are any deficits. So there are some people or some athletes who are more flexible, so even that is something that needs to be understood. Not necessarily that we are just take it because how, okay, you are flexible so you can get away with certain things, but no, there are certain elements or rather certain factors attached to it, and we need to understand why it is so. Okay, so this is just a sample sheet where you can see a lot of things that we see. This is just one page, and we have a lot of, as I said, parameters to look from head to toe. Okay. Now, functional movement screening. Let us move on to this particular thing where we should understand that how the body moves is very, very important. There are some very basic movements like sitting, standing, that sitting from sleeping position, standing from a chair, sitting down on a chair, very basic movements. But in that movement, there were some studies done by Mr. Gray Cook, who from USA in the early 90s, and then he developed this functional movement screen, which is very, very important. We use it very regularly in our practices, which gives us a lot of idea about how the body movement patterns are. So from this, specific areas that we identify are could be in a problem, and then we analyze it further. So this functional movement screening is nothing but it is a series of these 7 tests that we see, and these tests are basically done using some props, and we come to know how much are the athlete is in problem in terms of movement. So these 7 tests of course, doing the test is very, very like, it's a normal activity, can be done in like 5 minutes. But analyzing it, interpreting it, and then making a plan out of it is something that needs a lot of training. So there are specialized courses that FMS has, and you need to understand that just by doing test and scoring it doesn't make you, kind of give you solution to it. So this is basically a scoring kind of a testing system where all these seven tests uh, are basically scored from 0 to 3, and uh, there is technically a range that is given, so if you score 14 and less, you are kind of in a zone of an injury, and if you are 14 and above, you are sort of injury free, in an injury free zone, but provided you score 2 in almost all tests. So there are a lot of technical issues, but to help you understand that this is also a part of assessment, and this is very basic tests, that we do. And once we know how the pattern or how the movement pattern is, we can definitely not only start correcting it by giving exercise prescription, but also that helps in the longer run. So this is one part of it. Now, mat assessment is something very new. I want you all to focus attention on. So this is basically quantifying certain movements which was not done before. There is what do you say, Australian physiotherapist who have developed this particular mat, and we kind of measure a lot of parameters using this particular mat. Not only, as I said, ranges from the hip and ankle and spine, but also certain, we call it balance test and even power test for your legs. So there are too many things that can be identified using this mat, and this also is a part of that whole assessment program or protocols that needs to be understood. So as I have been telling you that there are, as I said, medical evaluation, your anthropometry, your physical testing, your physiotherapy testing, your posture, your functional movement screening, your mat testing. So these are all subjects that you can sort of, to just to understand, and you've got to play or rather score better in all these parameters to perform better and remain injury free. So there are things that, as I said, these are all the physical stuff. Now we come to fitness. Okay, now what is this fitness components? Everybody are aware of endurance, strength, flexibility, power, agility. Now these are major components of fitness, okay, and general components of fitness. Now if we don't analyze, or rather if you don't assess all these parameters, you don't know whether you're lacking flexibility, you're lacking agility, whether your endurance is low, or whether your power is low, whether your strength is low. So you have to understand that this is the combination of everything. You cannot have just good endurance and no agility altogether, or no flexibility but good strength. So it doesn't work that way. You have to follow that all these parameters that you see, the major parameters, you need to work on it, and it in obviously cohesiveness, first to understand what your baseline is, and then start developing each of these parameters. So very, very important to understand that. And just to kind of, help you a little more, people confuse between their stamina and their endurance and their strength and power. They're very different. So even if you see, like, in endurance, there is, muscle endurance is different, cardio respiratory endurance is different. So you have to, there are, as I said, these are just major general components that we should look at, but there are certain subgroups and sub elements that are very, very important, which we need to identify and understand. But just for your knowledge, I want to focus more on these general components of fitness that basically needs to be assessed regularly. Okay. Now uh, we come to physiological assessments. Now these things obviously need very high-end labs, and this needs a lot of technical knowledge. This needs a lot of expertise to not only conduct the test, but also to evaluate them or analyze them and then implement. Now, very few labs in the country have come up where all these things are there, uh, but these are direct kind of, very expensive kind of labs that are available, but as I said, not everywhere you'll find these particular testing facilities. It could be VO2 max testing, it could be, with together it can be done with lactate threshold, but biomechanical analysis where you have this 3D motion sensing camera systems and force plates and things like that, or you have reaction time, coordination time that needs some equipments as well. So there are labs that can give you exact quantification. These are gold standards used in most of the advanced countries, and most of the professional athletes undergo these particular physiological assessments very routinely and regularly to understand their obviously parameters, physiological parameters. So we are getting there. We have these particular things available now. We can get most of the things done, but we lack expertise, unfortunately, and we need to focus on getting at least the certain results from indirect methods. So this is one part which is important, but as I said, very expensive and specialized. So this is one. Now let us go to skill assessment. As we start to come to an end to this particular talk, which I wanted to focus on assessments, basically it is more important to understand that skill assessment are sport specific tests. Now, athletes who have been playing different sports, the demand of every sport is very different, it is not a rocket science. So just to give you two examples now, in tennis you don't have to jump high, like there's no role of jumping in tennis. But in badminton, if you see, both are racket sports, but you need to kind of, have a lot of jumping when you smash the shuttle. So if you talk about skill, then we cannot have a lot of jumping test assessments for tennis players, but you can definitely do it for the badminton players. Similarly, there is no point in testing a marathon player for powerlifting. You have to understand that what you kind of assess for a marathon player. It could be running gait analysis that you do to identify the running gait, rather than you testing him for weights. So there are, as I said, depending on the sport, you there are tests that are designed for that particular sport, and they have to also they need to be done on a very regular basis to understand how you are kind of facing those tests and scoring on them as well. Here, let me tell you that coaches play a very vital role because they understand the sport better. So, whenever we do any skill assessments for our athletes, we take help of coaches. We obviously discuss this on field testing with the coaches, and then we test them and discuss those results with the coaches. I mean, including others. But yes, coaches gives us good insights and inputs into how the test went. So very important again, and this is almost most of the times these skill tests are done on field according to their sport. uh, Again, coming to the end of the physical assessments that we spoke about and skill assessments we spoke about, I'm not going to go into the details of nutritional assessment, but very important to understand that all athletes have to understand what goes into their body, and whether it is right, whether the proportions are right, whether the nutrients are right. So if you have an assessment done, it becomes easier for the nutritionist or the dietitian to formulate your diet. So before even following any diet plan, you have to get your nutritional assessment done, whether you lack more of proteins, or whether you lack more of carbs, or whether you're taking excess carbs. So once you know that, so it becomes easier for the nutritionist to plan your diet. Now this is nutritional assessment. uh, Not to forget the mental assessment. Now everything is right, and you have to understand that most of the time you kind of do your nutrition better, your physical training better, you continue to do your competition pre-competition schedules better, uh, your skill set you keep on doing and nurturing and enhancing more. But what about the mind? When it comes to competition phase especially, lot of athletes, they have uh, basically problems with controlling their mind, in the sense obviously that affects performance directly. So very important to understand and assess the mental makeup of that particular athlete. So you have to understand that before going on to uh, going ahead and getting into the competition directly every single time, not facing facing the same problems over and over again. You have to take help of a mental conditioner or a mental coach or a sports psychologist, which will give you mental exercises. So this is very important. As I said, you most of the athletes who are competing at a higher level, they take help of mental coaches and mental conditioners to understand what how to train their mind during competition. So very very important to get this mental makeup done as well. Thank you so much. I think whatever assessments are all about, I have tried to kind of include the parameters that we follow, the protocols that we follow. For any questions, you can contact Praveen sir and get those details. You can shoot the emails to whatever you can see on my on your screen right now. If you have any kind of a problem, you can just mail on that email and we'll try and sort it out. So thank you again. I think it was great interacting, and hopefully I'll take some questions and let's see how best I can help you today. Okay. Thank you. Thank you.
Yes, now you can ask your questions in the comment section. Yeah, thank you, sir, for the knowledge you shared with us. Thank you so much.
Yeah, let me just, I'm just trying to close the PowerPoint. You don't see the screen, no, now? It's okay, no?
Yes, you can shoot in your questions.
All right. I think I'm just going through certain, I guess some people couldn't hear me properly. I'm sorry, some technical issues, I believe, but I'm trying to be very loud. Hopefully, after that, people will have got to listen to some words at least. But in the beginning, I guess, so I'm trying to come close to the screen and, kind of shout a little because I'm just there in my clinic alone. All right. So, what can be done for shoe bites? Somebody is asking. So, basically, again, shoe bite. We need to understand why you're getting shoe bites repeatedly. Whether it is the skating shoe or your training shoe is something that we need to understand. If it is a skating shoe, is the mechanics going wrong? Have you consulted your coach whether uh, the frame has been set right? If it is the training shoe which you're getting, then either it is the size that is a problem, some friction that happens usually is something that you need to understand. So there are these two three factors. So specific shoe bites, if you're happening over and over again at the same spot, then there has to be some reason which you need to identify and treat it accordingly. So make sure that you talk to the coach if it is your skating shoe and getting in the same place over and over again. We have to understand either the mechanics are wrong or there is something to do with friction. Okay. uh, Banyan issue, I believe, there are two things. One is a lot of skaters have this problem. They, because the skating shoes are extremely tight, in the sense they are much more tighter than your regular shoes. Some people, they do develop bunions. Usually, if it is more of a very severe grade, then there are two things that you can do. Start using either toe spacer, we call it, where you just have to place a silicone spacer in between your great toe and the second toe. And if that doesn't help, then as I said, depending on the grade, you'll have to decide what you need to do, whether you are using a custom shoe or you are using a regular shoe, because even that usually kind of is a problem. Uh, Third thing which is important again is, if we have hereditary, things, that your mother or father or grandmother, grandfather had a big bunion, then there's a possibility that you might inherit from them. Last option is surgery. There are surgical good results that you get when you just chop off the bunion, straighten up the toe, and continue working. So okay, so while doing plyo exercises, getting pain in the ankle, 12-year-old boy. See, basically, as I said, very difficult to answer these particular questions without having examining the particular. Right? So, it will be very difficult to answer such questions where I'll need some physical examination and understand the pathology behind it. Uh, and if there are, as I said, if you can stick to asking me something about assessments, it will help everyone. But this particular ankle pain, there are so many reasons that can cause ankle pain during plyometric activities. But after examination, I'll be able to comment a little better. So excuse me if I can't answer this, because it depends on how I examine. Okay. 6.5-year-old, knee pain, high jump forward, same thing again. As I said, uh, very difficult to understand. 6.5-year-old is a growing age. Uh, Very important to understand that jumping activities might elicit some pain in the knee, especially in front of the knee. If you start getting that pain there in the knee. So Mr. Rajiv has asked me about his son. I think it is important to understand and figure out if it is a growth pain. If it is a growing pain, you'll have to take some precautions. Uh, Identify it, whether there is any swelling there right below the kneecap. It is completely normal if it is a growing pain, and you just have to curtail on doing forward jumps and high jumps. And once you kind of rest it out, you can come back and do it. So 6.5, as I said, is a growing age where you need to be a little careful. Okay. uh, there's something else as well as coming up on the screen. Let me just check again. Coming back to the same question, I think I've answered it for shoe bite for somebody else. So uh, it is fairly common. I've already answered about shoe bites. All right. Any one question? How to recover from uh, shin pain? Okay. See, shin pain again has it is very common, not only with skaters, but also other athletes who are into any running or mostly running activities, and any sports that involves running. In skating, also, I have seen a few athletes suffering from shin pain. You have to make sure that your mechanics are right, in the sense you don't have any muscle imbalances from your hip, because it is not necessarily that shin pain are only related to the shin. The pain can the cause of the pain can be in your hips as well. So get it diagnosed properly, because once you get the root cause out, then the shin pain definitely can go. So recovering from shin pain, a lot of athletes, as I said, they show different responses. There are a lot of mobility and issues with the ankle as well as the knee and the hip for shin pain. So you need to understand and address the root cause. So get it diagnosed, and then it will be easier for you to recover from shin pain. Okay, but till then, foam rolling is something that you can do. Stretching and proper warm up. make sure that you take good care of your muscle conditioning, and it definitely helps. And I mean, before me commenting on this, I am sure it has been diagnosed as shin pain and not anything else. So that is also important, because there are certain pains that can mimic shin pain, but it cannot be shin pain. So you have to understand that whether the diagnosis of shin pain is right. Okay. Uh, Somebody has asked a question about improve energy level of a 7-year-old. Energy levels obviously can. There are a couple of reasons why. What happens is, whether the nutrition is right is something that you need to look at first. Uh, Before having done any medical evaluation, check with the pediatrician whether there are no other aspects which are causing her to not have good energies. Once the pediatrician gives a go ahead, then you need to get back to your nutrition expert or your dietitian and start planning a better diet, time wise nutritional diet, and that usually helps improve the energy levels. uh, Even modifying the body clock at some point will give you, the recovery needs to be really well. You cannot have multiple sessions on one day and not recover well from that particular thing. So there are these 2 3 things that you need to understand. Once you have good recoveries in between two sessions, you will definitely have better energy levels when you go forward. Barefoot running, I know there are people, there are two schools of thoughts. Barefoot running, as I said, is not something that cannot be done. There are a lot of people who do barefoot running. It needs a lot of practice. You can slowly shift back to barefoot running, provided your mechanics are right again, and you've got to get used to it. Some people I see that they come back to uh, they come back with injuries after 6 7 8 months of shifting to barefoot running. That could be because they try and achieve too much too soon. So you just have to maintain a particular scientific plan to run without shoes. You can definitely you know go ahead and if you want to go barefoot running. Yeah, there is one question. Uh, yeah, Praveen. So basically, as I said, the whole assessment, or whatever I was talking about for the last few minutes, it was all bent on doing assessment. Uh, if you have not done the assessment, a serious sportsman need to understand that if you don't know your basic values of your different parameters, be it fitness or skill or your muscles or if your joints and your medical parameters, your physiology, it is not going to help you to progress. So simple thing, as I said, you must be studying hard for your exam, but if you don't give exams only, you will not understand whether you're scoring well in what particular subject. So maybe you're working very hard, and you're doing studying for 4 subjects out of 6, or rather you're studying for all 6 subjects, but you don't know whether you're scoring well in those subjects, because we compare those scores with international standards depending on the athlete, and then we come to know no where you stand. So your basic parameters are very very important. So I definitely want all the athletes who are competing at some level, and they need to get their assessments done, because that is the base of every training program that you follow, every plan that you do for your competitions and stuff. So you need to understand your baseline values for sure. So that is how important the assessments are. How can you decrease our weight? That is a problem of the whole world, and decreasing weight is something that is the whole world wants to decrease weight. So, very tough question to answer at such a short notice. But if you have a good lifestyle, better nutrition, don't have any underlying medical causes, you follow a good scientific fitness program along with good nutrition, definitely I have seen results coming up. There are no shortcuts, mind you. Weight loss has no shortcuts. You have to understand this. There is no crash thing that can work on a long level, on a long term. So you need to understand that. Any basic exercise to check or assess skill sets like power, endurance? See, basic, as I said, there are, let me just talk about power. Now, power test for lower extremities or rather for the legs is very, very simple test that you can do is there is something called as a broad jump or a forward jump test. You just have to, kind of draw a line, and with both the legs, you just need to jump forward and land without losing the balance, and you come to know how much that distance is, and you have to compare it with the standard of that particular normative data of that particular age groups. So I'm just trying to make you understand that yes, power tests are these important for lower legs. For upper body power, obviously you have something called as medicine ball chest throws. You just cannot do the test. You have to compare it with the standard normative data and then conclude, and then you decide. So power, we can do it with single leg also, double leg also, sideways also. So as I showed you in the slides about the mat test that we did, in the mat test we kind of understand a little more. We quantify a lot of lower body power tests as well to measure, and then if we know that it is lacking, we have to give exercise prescription and to improve it. So obviously it is a process, but it does show a lot of improvement when we give specific exercises to increase power. Okay, now
Maybe we can take one last question, sir.
okay, Praveen has the last question and a good question too. What is the right age for assessment? Is what Praveen has asked. So see, assessment can be done as early as a 9 and a 10-year-old. So that is an age where we usually start assessing athletes, but we don't assess them on the entire, like the process which I explained. So there are certain fitness tests that we don't do for youngsters. There are certain power tests that we don't do for very young athletes. There are certain strength tests that we don't do for young athletes. So depending on the age, but you can start assessing. Uh, I mean, a proper assessment as early as a 10-year-old, but just do the clinical assessment. You can do it even before that. So as I said, we depending on the age and the type, we decide how much to load that particular athlete into assessment. Okay. Last question
Okay.
is how often we should do physical assessment for an athlete or a skater, like height, weight, arm span. See, this is basically, as I said, very important to do it very regularly. What we follow here with the competing athlete who are competing at the highest level, we make sure, depending, as I said, on their age group, we take their height and arm span and waist, etc. But when it comes to uh, dealing with athletes who are senior, like they have finished their growth spurts and they are into competing categories at the highest level, we start assessing them every 4th month, definitely before a preseason, so that they are ready to go into preseason training and then competitive season. So this is very important to understand that it is not a straightforward format that we follow, that this is the timetable for assessment. It depends on the athlete, the age group, the sport they play, and the time, the phase of training they are in. Okay, thank you.
Okay. Thank you so much, Doctor. We at Prowins have an association with Dr. Ajit Mapari and Fit to Sports since a long time. Our athletes are at great benefit because of his help and because of his depth in knowledge and with his great expertise, they get benefited by it. And he has given us an insight right from basic medical evaluation, right from the basic tests, the movement tests, the mat test, the general components of fitness, physiological assessments, skill assessments, right till your mental makeup. So thanks a lot, Doctor, for the session. And I would just invite Praveen sir for a few words.
Anyway, thanks a lot, doctor, for such a valuable information for our athletes. और हमारा जो एसोसिएशन है फ्रॉम लास्ट सो मेनी इयर्स, जो भी हमारे एलिट एथलीट्स है उनको टाइम टू टाइम मैं आपके पास लेके आता रहूँ, आपका कंसल्टेशन, आपका नेविगेशन, मार्गदर्शन उनको और मुझे भी जो मिल रहा है. सो माय एक्सपीरियंस इज आल्सो विथ यू, लाइक एट दिस एज द वे यू आर गाइडिंग मी, फ्रॉम दैट मुझे आपका इंपॉर्टेंस और वैल्यू और स्पोर्ट्स मेडिसिन का इंपॉर्टेंस समझ में आ रहा है एंड योर एक्सपीरियंस. सो मैं सोच रहा था कि यही चीज बेनिफिट सभी बाकी एथलीट्स को भी मिले स्केटिंग के. हमारे पास भी बहुत सारे नंबर है, आज शायद थोड़े लिमिटेड लाइव में प्रेजेंट होंगे वर्किंग डे में, बट दे ऑल विल सी टू योर सेशन. मैंने नोटिस किया लास्ट सेशन में बाद में ज्यादा लोग ऑब्जर्व कर रहे हैं. सो आपका मैसेज ये मैक्सिमम लोगों तक पहुंचेगा. और थैंक्स लॉट वंस अगेन. और फ्यूचर में जो भी हमें हेल्प लगेगी एकेडमी की तरफ से, we'll call you again for either webinars, for consultation, whatever. Thanks a lot, doctor.
Sure.
Good day.
Thank you, Praveen. Thank you so much.